Plan G offers the most comprehensive coverage available to new Medicare beneficiaries. But is it the best? Watch this video first to learn more. Hi there, as always, if you have questions about your Medicare or health insurance in general, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there is, of course, no charge for our services. All we ask is that you make sure to like this video and subscribe as well for our weekly updates. All right, let's get to it. Now, Original Medicare really does offer excellent coverage, but there are definitely some out-of-pocket costs that you may not be aware of. These would be things like deductibles and copays and coinsurance. And remember, there is no out-of-pocket maximum with Original Medicare alone. Original Medicare is broken up into Part A and Part B, and there are separate out-of-pocket costs for each. Part A usually doesn't have a monthly premium, but there are deductibles and copays and coinsurance, and again, no out-of-pocket maximum. The deductible is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share, which would be the copay or the coinsurance. Now for Part A, the deductible is a little bit strange because it's not applied annually, but rather per benefit period.
So the Part A deductible in 2024 is $1,632. This is applied per benefit period. And there are two different types of facilities for benefit periods, either in a hospital or in skilled nursing facility. So in a hospital, it would begin the very first day that you're admitted as an inpatient. And then once you're released from the hospital and you haven't gone back to the hospital for any reason within 60 days, that would be the end of your benefit period. For a skilled nursing facility, it's pretty much exactly the same. It's the day that you're admitted. And then once you are released, 60 days from that, as long as you haven't had to go back into the skilled nursing facility within those 60 days.
Part B is much more straightforward. It is applied once annually, and in 2024, the Part B deductible is $240. Then there are copays and coinsurance. For Part A, your copay or your coinsurance is determined by the facility in which you are receiving care and the length of your stay.
So your coinsurance is determined by the type of care you're receiving, and of course your length of stay. So if you're inpatient in a hospital, days 1 through 60, there's no coinsurance, there's no charge. After that, days 61 through 90, it's a $408 copay per day. For days 91 through 150, it's $816 per day. Now, these are considered your lifetime reserve days, which means that you only get to use these up once. And after 150 days, you would pay all costs. Skilled nursing facility care, days 1 through 20, $0. 21 through 100, $204 per day. 101 beyond, you pay all costs. Home health care and hospice care, there's no charge for those services.
For Part B, your coinsurance is 20% of the Medicare approved amount for a given service or treatment. So if the approved Medicare amount for a given service or treatment is $1,000, your coinsurance would be $200, assuming you've already met your deductible. Now with Original Medicare, Part A and Part B, there is no out-of-pocket maximum. An out-of-pocket maximum is basically a yearly cap on your medical spending. So once you've reached that financial threshold, your insurance carrier would take on the remainder of the bills for the year for covered in-network services. It's basically there to protect you from major medical debt. So you can see that these out-of-pocket costs without an out-of-pocket max can really stack up. And that's where Medicare supplement plans or Medigap plans fill in. There are 10 different Medicare supplement plans available with varying levels of coverage and varying price points. More on that later in the video.
So here are the 10 Medigap plans available. Plan A, B, C, D, F, G, K, L, M, and N. And this chart just details what benefits are offered by which plan. Now remember, Medigap plans aren't going to offer additional benefits that aren't already offered by Original Medicare. For example, Original Medicare doesn't offer dental benefits, so you're not going to see that any of these plans offer dental benefits. Instead, what they're going to do is help to cover or possibly entirely cover copays, coinsurance, and deductibles. So basically, you pay a little bit extra, but almost all of your out-of-pocket expenses, or possibly all of your out-of-pocket expenses, will be taken care of. So you can see that all of the plans will cover your Part A coinsurance, which is extremely helpful. All the plans will cover in some capacity Part B coinsurance or copays. Plans K and L are known as cost-sharing plans. So basically, they're going to contribute to these out-of-pocket costs, but Plan K will cover 50% of your cost, and Plan L will cover 75%, and that's just pretty much, generally speaking, across the board. All the plans will cover the first 3 pints of blood in case of need of transfusion. Part A, hospice care, coinsurance or copays, that's very important. Skilled nursing facility care coinsurance, again, very, very important. The only plans that don't offer that is Plan A and Plan B. Your Part A deductible, that's that deductible that's applied per benefit period. So if you do need to be hospitalized more than once in a given year, then you might have to meet that deductible again, and that can certainly be very expensive. The Part B deductible, no plans that are offered to new enrollees are going to cover that Part B deductible, but that's a once annual deductible and it's not very expensive, so it's not your biggest concern. Part B excess charges. So basically, if your doctor accepts original Medicare, then they accept the amount that Medicare is willing to pay out. However, they can choose to charge an excess charge, which is up to 15% more. Now, I wouldn't necessarily worry about these because they're not all that common and they're not even permissible in all states. The only plans that do cover Part B excess charges are plans F and G. Plan F is one of those plans that's not offered to new enrollees, but if you are looking for the most comprehensive coverage available to everyone, then that would be Plan G. Foreign travel, almost all plans will cover that in some capacity, 80%. And then there's this out-of-pocket limit. You'll see it's asterisked here because it's not really applicable. For example, Plan F and Plan G, and even to an extent Plan N, are really going to cover all of your out-of-pocket expenses except for possibly that Part B deductible. Plans K and Plan L, because they are the cost-sharing plans, they do have an out-of-pocket maximum, which is very helpful because if you do have major medical bills, original Medicare doesn't have any type of limit or threshold on what your spending could be.
Now, with Medicare supplement plans, benefits are standardized. So that means that the benefits for Plan G do not change from carrier to carrier. The only thing that changes is the price. And remember, if your doctor or hospital accepts the original Medicare, then they accept your supplement plan, regardless of who the carrier is. So obviously, Plan G is a great plan. So why wouldn't you want one? Well, let's take a look at the prices.
So this is Medicare.gov. Remember that the prices that you will see are very much so determined by your area. I'm putting in some basic information here, but also should you choose to enroll after that initial 6-month window after you turn 65 and enroll in Part B, then you may be subject to medical underwriting, which means you could have higher prices or you could be denied outright. So please bear that in mind as well. Here we have plans A, B, C, D, F, the high deductible version of Plan F, G, the high deductible version of Plan G, K, L, M, and N. So for argument's sake, let's compare Plan N versus Plan G because those are the two most similar plans being offered to new enrollees. So Plan N is going to cost somewhere between $182 to $290 based on the information that we've put in so far, versus Plan G, which would cost somewhere between $233 to $381. So if you had a plan that was $233 per month, you're looking at roughly $2,800 per year. And if you had a plan that was $182 per month, you're looking at a plan that's roughly $2,200 per year. So about a $600 difference if those were your prices. Now, if that were the case, really the only difference between Plan N versus Plan G is that there are those Part B excess charges with Plan N, which again, not very common, and sometimes there's a $20 or $50 copay. Now, that being said, as I mentioned, those Part B excess charges, very infrequent, and even if you did have some copays, let's say that you did in fact have 10 instances a year with a $50 copay, that's a $500 that you would add, and still you would come out better with Plan N. So that's just one way of running the numbers. The important thing is that you basically have to run your numbers because I'm looking at something that's listed here on Medicare.gov. But if the best rate that you could get for Plan N was, let's say, $200 per month, well, then you are looking at $2,400 per year versus that $233, which again we said was about $2,800. So then there's only a $400 difference. And at that point, maybe it would make more sense to go with a Plan G if you don't have to worry about those copays and those Part B excess charges. You can also look at something like Plan L versus Plan K and Plan G. So those are going to be much less expensive plans, especially Plan K. That being said, because you still have those 50% of the costs, Plan K is probably not the best way to go. But let's say you wanted to do Plan L, because then we're talking about 75%. So it is covering a good chunk of your copays and coinsurance. So if we're comparing 175 to 233, again, those numbers are coming out pretty close. That 175, if that was the rate you were able to get, would bring you to $2,100 per month. But then if we're looking at the deductibles, let's say you only had to be hospitalized, or you did have to be hospitalized once per year, well, then that's at least $408, which now brings you to $2,500. And then let's say you have some Part B charges, you're getting pretty close at this point. $2,500 plus any additional copays or co-insurance, or possibly even an additional hospitalization deductible. You're looking pretty close as far as these numbers are concerned. So again, the most important thing to determine is what your rates would be, what the best rates are that you can get, and then you can really, really compare apples to apples. You're also going to have to make the decision, do you want to take the risk, basically, with one of these less expensive plans, because you could end up saving money on something like Plan L. You absolutely could if you don't need to be hospitalized, if you don't have significant Part B expenses. However, if you do have to be hospitalized once or maybe even more than once per year, and you have some Part B expenses, then something like Plan G actually is going to save you a lot of money. Basically, you may be paying more upfront, but should you need to utilize your services, you'll save a lot. So somebody that is planning on or thinking ahead to maybe needing to utilize their health insurance more frequently, Plan G is better. If you want to take a risk, then something like Plan K or Plan L would be better. And of course, Plan N sort of splits the difference, because it's really very similar to Plan G, with the exception of those Part B excess charges and some of those copays. So compare the rates, run the numbers to determine what your lowest possible cost would be for each plan versus your highest possible cost when you have to take into consideration copays, coinsurance, and deductibles, and determine what monetary value is worth the risk. Is $200 worth the risk? Is $400 worth the risk? Is $1,000 worth the risk? That's a decision that only you can make. But ultimately, yes, Plan G is still going to provide you the most comprehensive coverage. So if you weren't thinking about premiums alone, Plan G is still the best available.
Now, we used to compare Plan G and Plan F in terms of value and price, because they really are very similar. The only difference is that Plan F covers the Part B deductible and Plan G doesn't. However, historically, Plan F has been much more expensive than Plan G. However, there was another reason to choose Plan G over Plan F. Now, every year, premiums for Medicare supplement plans tend to increase, and this is to accommodate for rising healthcare costs and inflation. However, in the past, Plan F has increased at a much steeper or dramatic rate versus Plan G. So, again, another bonus point for Plan G. Now that Plan F is being slowly weeded out, you may notice that the rates for Plan G tend to increase at a more dramatic rate. So Plan N might be a safer option. And this is where working with a broker really comes into play, because not only will a broker compare all of the different carriers available for the specific plan that you're interested in your area without you having to call each one individually, but they also have a history with these carriers. So they can advise you as to which carriers or companies have a history of slower, less drastic rate increases versus others. Because remember, with Medicare supplement plans, you don't want to have to go and change your plan or your carrier further down the line, because any enrollment or changes made after that initial 6-month window after you turn 65 and enroll in Part B may result in medical underwriting. So you really want to think further down the line and find a carrier and plan that's going to suit you not only now, but in the future. And that means not only that the benefits work for you, but that also the prices will work for you, not only now, but in the future as well. So what do you think? Is Plan G still the clear-cut winner, or are there other plans that might be edging Plan G out? Let us know in the comments below. And of course, if you have questions, you can reach us in the comments or at the number on the screen. Thank you so much for watching, and we will see you next time. Bye-bye.
If you want to learn more, make sure to check out this video to learn more about the differences between Medicare supplement plans and Medicare Advantage. And don't forget to like and subscribe. We'll see you next time.